I would like to thank Rich Tyler for enabling me to speak to you at the 21st Annual Tinnitus Conference on Management of the Tinnitus Patient. I would like to give you a brief update on what I would call a cousin of tinnitus, hyperacusis. Studies have indicated that up to 40% of individuals with clinically significant tinnitus experience hyperacusis. Chances are pretty high that most of you in your work with tinnitus patients have also treated patients with hyperacusis. I'm Bryan Pollard, founder of Hyperacusis Research Limited, a nonprofit dedicated to raising the essential funds to enhance the research for hyperacusis. I'm a technical process expert in the semiconductor industry, and I'm fortunate to work in the industry that is part of the technological backbone that allows today's research to be executed at unprecedented speed. The most advanced computing chips we build contain billions of transistors. In my role at our semiconductor fabrication facility, I analyze issues and provide a framework for problem-solving methodologies for the technical issues that arise with the process. One of the primary problem-solving approaches I use is a methodology called TREES, a Russian innovation technique that was formed from the development of scientific principles that apply to all innovations in virtually all industries. The theory of the technique is to break down systems to their most basic function level and find the key disadvantage of the system. Next, the disadvantage is generalized in order to find a solution concept from a different industry. Now that you know a little about my background, I want to take a few moments to explain why I started this effort and where I see the opportunities are for the future. There are three areas of interest I would like to briefly discuss: patient symptoms, patient to researcher connections, and clinician to researcher connections. I first acquired my hyperacusis condition in February of 2008 after a wood chipper was next to our house chipping up a tree for several hours. I met with several different otolaryngologists who had no findings, as all of my audiometric tests results were normal. Eventually, I determined I had developed hyperacusis. I quickly realized that my pain fluctuated with the noise level I was exposed to. I found that there was one TRT-trained audiologist in the area, and I made the first of numerous 100-mile round trips to participate in the TRT therapy. After a year of TRT therapy, I saw a modest improvement in terms of what I could tolerate for which noises would create pain, but there were still many everyday noises, such as lawnmowers or music in stores, that created pain which sometimes lasted for hours at a time. As a patient, I wondered if I was unique. My audiologist considered my symptoms to be typical. So I read the hyperacusis blogs to see what other patients were saying about their experiences. I was able to connect with many hyperacusis patients. I'd like to share with you one story about Jesse, a military veteran who was in the National Guard for 12 years, and one day, one round of munitions exercises left him with a debilitating hyperacusis. Listen as Jesse tells his story and the impact on his family life.
My name is Jesse Lovell, and I've had hyperacusis for 8 years. I have a wife and 3 children. How has hyperacusis affected me? It has not only affected me in hobbies I enjoyed, such as hunting and fishing, it has affected me in all ways because I spend most of my time hiding in the basement of my house, hiding from the sounds of the world. Never mind not going to movies, concerts, festivals, sporting events, etc. It is difficult for me to even hold a conversation with someone because their voice hurts me. I got hyperacusis from weapons fire in the military. Prior to getting hyperacusis, I didn't even know there was such a thing as sound sensitivity. It is very difficult to get help in the beginning because when you go to a doctor for something rare, odds are they probably have never heard of it and also steer you in the wrong direction. There is a difference with having hyperacusis, say, at the 2-year mark than there is at the 8. At the 2-year mark, you are just dealing with the sounds that are causing you pain. After 8 years, you have the addition of the effects of 8 years of pain and meds dealing with in addition. These effects can be anything from chronic fatigue to insomnia and many, many others. Treatments and therapies that I've tried are tinnitus retraining therapy, mnemonics, acupuncture, reflexology, sound enrichment, and musicians' earplugs. The only one I had any success with was tinnitus retraining therapy. I did it for 2 years, and about the 1 year mark, I felt I was nearly cured for about a 2-week period. Because I was told there was a 95% chance that I would be 100% better, I started doing normal things. This was a mistake. In my opinion, once you have hyperacusis, you are susceptible to getting it again or having a setback. Medications I have tried are both narcotic and non-narcotic. The non-narcotic type are medications for other illnesses, such as for fibromyalgia or seizures, since there is no medication for hyperacusis. These medications have been to no avail. They have just added additional problems with their own side effects. What I hope to see developed out of hyperacusis research is a cure, of course. Like anybody with a health issue, I would like it to go away. After 8 years, however, I personally would be happy to just be able to live a normal everyday life without having to hide from the world's even smallest sounds, even if this means that I don't go to anything loud.
Jesse's story is representative of many other stories I've heard from patients. From these patients' experiences, there are some key questions which need to be answered. Why do many hyperacusis patients have such difficulty getting a quick and accurate diagnosis? If patients have such a significant amount of pain, both initially and from new noise exposures, shouldn't researchers focus more on the mechanisms of pain? After a year or two of apparent recovery, why can a hyperacusis patient have such a significant setback from new noise exposures that others can tolerate? These and other questions prompted me to start contacting researchers directly. After many technical discussions with researchers and seeing the need for a voice to represent struggling patients, I formed the Hyperacusis Research Limited organization 2 years ago. You'll notice on our site that we are dedicated to stopping noise-induced pain. I coined this term, noise-induced pain, from the same idea as noise-induced hearing loss to communicate in a simple way the most challenging impact some hyperacusis patients feel. I also have done brief survey questions on pain to get better symptom data to researchers. This question, what type of pain do you get from noise, had the following results from 63 patients. Sharp pain, 29%, dull pain, 19%, burning pain, 17%, headache, 11%, throbbing pain, 18%, and 16% said they don't get pain. There are other common symptoms beyond pain that many patients describe, which also may help researchers. Oral fullness, ear fluttering, and of course, tinnitus. In the past few months, our website hit rate has grown to over 1,400 page views a month, and demographic information shows that people from all over the world look to our site to learn more about hyperacusis. We have seen different focuses in how patients are treated in various regions of the world, and other ways to categorize patients with noise-induced pain. One condition very similar to hyperacusis is acoustic shock syndrome, which Miriam Westcott from Australia has described in several publications. This condition is especially interesting because over 70% of patients with this condition experience pain in the presence of loud noise. Of course, our key objective is to impact the actual research for hyperacusis. Earlier this year, we helped organize the first hyperacusis workshop at ARO's midwinter meeting. At the workshop, one patient told her story to a room full of nearly 200 researchers. We had 4 speakers who presented various aspects of hyperacusis research. Brian Moore from the University of Cambridge gave an overview of sound sensitivity. Next, Dave Bagley from Cambridge University Hospitals spoke about the epidemiology and etiology of hyperacusis. James Henry from the VA National Center for Rehabilitative Auditory Research spoke about methods for diagnosing hyperacusis, and Billy Martin from the Oregon Health and Science University reviewed hyperacusis treatment options. We were able to record these talks, and they will soon be available on our website. From the ARO conference and other connections we've made, we've been able to help many researchers get a clearer picture of the hyperacusis patient. I've been grateful for the time researchers have given. For example, I visited Fan Gang Zhang in his office at UC Irvine last year, and he spent several hours asking questions and probing to understand the problem better. Professor Zhang has published a good framework for hyperacusis mechanisms by taking a systems engineering approach to draw distinctions between tinnitus and hyperacusis. Also, recently, I was able to visit with Charlie Lieberman and Jennifer Melcher at the Mass Eye and Ear Institute. Jennifer Melcher's work with the fMRI of tinnitus in hyperacusis patients reveals differences in various auditory processing centers of the brain. These are just a few of the dozens of conversations we've had with researchers which have demonstrated a strong collaborative spirit to accelerate hyperacusis research. Like any research effort, our first major work has been to support a research summary of everything known about the topic. I was grateful that we were able to connect with the Hearing Health Foundation and partner to help fund Rich Tyler here at the University of Iowa to complete a hyperacusis literature review. This review summarizes both the clinical data and key research papers to give researchers a valuable resource driving the next steps for research. How can you help? If you have clinical experience with seeing many hyperacusis patients, we would like to hear from you. We'd like to get a better understanding of the symptoms patients describe. There are various survey efforts underway, and we're trying to determine if a new clinical hyperacusis survey is needed or if the details we'd like to understand already exist within the current data. In addition to understanding hyperacusis survey data, in the coming year, we would like to focus on either improved diagnostic methods or exploring possible mechanisms underlying hyperacusis. We're also looking for new researchers to join our scientific advisory committee. We recently completed our first successful charity event, which helped to broaden the base of our supporters. We will continue to work to raise funds and forge partnerships to support the next phases of research. Please contact us to let us know your ideas. I know as we continue asking the challenging questions, we will move closer to finding the answers that will lead to a cure.